My name is Mike Cady, and I'm an obstetrician gynecologist. I live here in Crosby, Minnesota, and I've lived here since 2004. Endometriosis is a condition that we as gynecologists see very commonly. The incidence in the general population is thought to be about 10%. I think it's actually probably higher than that. I think a lot of it is probably underdiagnosed. And endometriosis is a condition that, you're right, can either be found incidentally. For example, if we're doing surgery for another reason, we may see it when we're performing a laparoscopic procedure, and patients will say, wow, I would have never known that I had it. But classically, endometriosis presents with certain symptoms, including painful periods, pain with intercourse, painful bowel movements, pelvic pain in general, and also infertility is common in patients who have endometriosis. So to explain a little bit about what endometriosis is, I can show this model of the uterus. Hopefully this will help. So as you can see here, this is a model of the uterus. So this is the vagina, and then the cervix at the top of the vagina, and then the uterus. Attached to the uterus are the fallopian tubes and the ovaries. So what they've done for demonstration purposes with this model is they've removed the top part of the uterus. And you can see that most of the uterus, this red part here, is made up of a muscle. That muscle is called the myometrium. That's the muscle that contracts when a woman is in labor. And then on the inside lining of the uterus is this pink lining, if you can see, and we call that the endometrium. So the endometrium is the inside lining of the uterus. And the endometrium is important in pregnancy. The ovaries produce hormones, primarily estrogen and progesterone. The estrogen and progesterone cause the inside lining of the uterus to thicken in preparation for pregnancy. And then when a pregnancy does not occur, this inside lining sloughs off and a woman will have her period, and then the cycle will start all over again. So what happens with endometriosis is, for reasons we still don't know for sure, although there are theories of why it may happen in some women, these cells on the inside lining of the uterus will end up in other locations in the body. And it's actually possible for endometrial cells to end up anywhere in the body, although most commonly they end up on the ovaries and the fallopian tubes, and then on the uterus and kind of under the uterus, and then can also occur in the muscle of the uterus. We call that adenomyosis, and they represent that here by these dark dots on the model. And when we see a patient with pelvic pain or painful periods or pain with intercourse, we can suspect that they may have endometriosis. But the only way to definitively diagnose endometriosis is to perform a same-day surgical procedure called a laparoscopy. So a laparoscopy is a surgery that we do here in Crosby. It's very safe. It usually takes anywhere from 30 to 60 minutes. Women end up having 3 very small incisions on their abdomen. And what that allows us to do is to place a tiny camera so that we're able to look into the pelvis at the uterus and the ovaries, and to determine if there are signs of endometriosis. There's a classic appearance of endometriosis, and what we usually do then is treat it with our laparoscopic instruments, and can also do biopsies that we can send off to pathology to confirm whether or not patients have this. So the advantage of laparoscopy is, one, we can diagnose it, but we can then also treat it at the same time. But in addition to surgical management for endometriosis, there are other management options as well. Non-surgical management options would include mainly birth control options. So birth control pills help not make endometriosis go away, but it helps kind of quiet down the endometriosis so it doesn't cause as severe symptoms for women. IUDs can be helpful as well. So again, there's other non-surgical treatment options that patients can pursue as well. It can, primarily in their reproductive years. So after they start their period up until menopause, those are the most common years where you would see women struggling with symptoms related to endometriosis. Yeah, it's the only way to definitively diagnose it. But, if somebody was like wanting to pursue other options prior to surgery, that would be okay too. So, for example, if they had really heavy, painful periods or pain with intercourse, we could try, if they did not at that time want to achieve a pregnancy, birth control pills, for example. And then if their pain went away, we could say to ourselves, well, you most likely do have endometriosis, but since your pain is better now, there's not really a need to move forward with laparoscopy. But if somebody said, I just want to know, it would ease my mind if I could know whether or not I have it, or if we do try medical management options like birth control pills and their symptoms do not improve, both of those situations would be examples of when it would be appropriate to move forward with a laparoscopy. There is definitely a hereditary component with endometriosis, so obtaining a family history is important. And one of the theories I didn't mention earlier, but one of the theories of why women may develop endometriosis is something called retrograde menstruation. So what that means is that as women are having their period, they believe that some of the blood may actually go not out vaginally or only vaginally, but also out through the fallopian tubes, and then those cells implant in the pelvis and continue to grow and can cause inflammatory responses, which then can lead to pain and the symptoms that we described earlier. So some people will ask, is there anything I can do to prevent endometriosis? And unfortunately, there's not. So some people will ask, can endometriosis lead to cancer? And there's not been any strong evidence that it increases a woman's risk of developing, for example, uterine cancer or cervical or ovarian cancer in the future. So, so that's not something that women need to be concerned about. But again, if they are experiencing pain and discomfort or infertility, we definitely be happy to see them so that we can do a workup and help improve their quality of life. Once women have gone through menopause, there are some people who believe that women can continue to have pain due to endometriosis, but it's much less likely, mainly because endometriosis is driven by one of the hormones that women produce called estrogen. So as women transition into menopause, their estrogen levels drop, and so they may still have endometriosis in their pelvis, for example, but they no longer have that hormone that would drive the endometriosis and cause the symptoms that they may have had when they were younger. Yeah, so if a patient is having these symptoms, which can commonly be found in women who have endometriosis, we're always happy to see them. They can call the clinic, call the OBGYN appointment line directly to schedule an appointment with one of us.